Hello guys, Assalamu alaikum and welcome to Revise Pathology. Today we are going to discuss on the topic that is changes after cell death. Okay. In the previous videos we have discussed about the irreversible cell injury and reversible cell injury. Okay. And what are the types of reversible cell injury and what are the types of irreversible cell injury. Now let us see what happens to the cell after they die or the changes that occur after cell death. So the changes that occur after cell death is gangrene and pathological calcification. So, gangrene occurs after necrosis, and pathological calcification occurs after degeneration and necrosis. Okay, so these are the two processes that will occur after, or two changes that will occur after cell death. What is that's gangrene and pathological calcification. So, now we will discuss what is gangrene and how many types of gangrenes are there. All right, let's proceed ahead. So, guys, coming to the first this one change, that is gangrene. Now let's see what is gangrene. Gangrene is nothing but it is a necrosis of the tissue. It's a type of a necrosis of the tissue that is that occurs with putrefaction of the tissue. Okay, and the putrefaction that and the entire gangrene mainly occurs due to coagulative necrosis. Fine. And the coagulative necrosis, what are the coagulative necrosis, what are the main causes is ischemia. Okay, so let's come to the a bit of definition. So what is there? It is nothing but it is a necrosis of the tissue that is associated with supraaortic putrefaction. Okay, and most often following coagulative necrosis. Fine. Repeating in once again, it is the necrosis of the tissue that is associated with supraaortic putrefaction, most often following coagulative necrosis. So three things occurs in it. What is that? Necrosis, supraaortic putrefaction, and coagulative necrosis. And all these three processes forms gangrene. All right. Next, coming to the types of the gangrene. So guys, the types. There are two types of gangrene. What are those? Dry gangrene and wet gangrene. How many types are there? Two types, dry and wet. Dry gangrene and wet gangrene. Now we will discuss in brief about what is dry gangrene and what is wet gangrene. All right. So guys, coming to the first type of the gangrene, that is dry gangrene. So what is dry gangrene? First of all, it's a type of a gangrene. Okay, and what happens in it? This type of the gangrene, it begins from the distal part of the limb. Okay, due to ischemia. That means it will grow from, or this type of the gangrene will start from any part of the limb, from the lower part of the limb. Okay, and it occurs due to ischemia. Okay, where ischemia will start. Fine. The second step, what is happening is here, this gangrene, it spreads slowly upwards until it reaches to the point where the blood supply is educate, sorry. Okay, so the gangrene will reach slowly upwards, all right, until there is a good rich blood supply. Okay, or there is enough blood supply, enough amount of blood supply. Next, what happens there? A line of separation is being formed. Okay, at a point between the gangrenous part and the viable part. So basically, in dry gangrene, three things occurs. It occurs by three things. What are those? First of all, it begins in the distal part of the limb. Okay, and then it slowly travels upward. That's the second thing. Okay, until it reaches to a good amount of blood supply. Fine. Third, a line of separation is being drawn that separates the viable part and the gangrenous part. And why does the dry gangrene occur? Due to ischemia. Okay, so this is all about dry gangrene. Now let's come towards the morphology and histology. So guys, coming to the morphology. First of all, if you see in the morphology, we'll struck the gross. How will it appear? How will a gangrenous part appear? It will be dry, shrunken, and dark black, and it will be resembling just like a mummy. Okay, especially the foot of a mummy. Fine. So what is it? Repeating it once again, it will be dry, shrunken, dark black, and resembling the foot of mummy. Histology, you will find necrosis, that's obvious. And which type of necrosis? That's coagulative necrosis. And in the line of separation, you will find inflammatory granulomatous reaction. Okay, what you will find there? Inflammatory granulomatous tissue or reaction will be seen where? At the line of separation. Okay, so this is your dry gangrene. Now let's go towards the wet gangrene. So guys, proceeding towards the next type of the gangrene, that is wet gangrene. So we will see what is wet gangrene. Okay, next, wet gangrene, it occurs in naturally moist organs or moist places. For example, in vagina, bowel, lungs, cervix. Okay, so what is wet gangrene? Occurs in naturally moist tissues and organs such as bowel, lungs, cervix, and vulva. And what are the best examples are diabetic foot and bed sores. Next, what is the etiology? Etiology is due to the blockage of both venous and arterial blood supply. Okay, now let's come to the morphology. Okay, guys. Now the morphology of first we will see the morphology of wet gangrene. Okay, so what will be the gross? The first one is it will be soft, swollen, putrid, and it will be black in color or dark in color. Fine. Obviously, dark and putrid or swollen or soft will be white due to the absence of the the venous and the atrial blood supply. Okay, and now microscopy, what you will find there is you will find coagulative necrosis. Okay, and the mucosa will not will sorry the mucosa will be slouched and ulcerated. Okay, and the most important thing in wet gangrene, there is no line of demarcation between the affected part and the viable part. Okay, between the affected and the non-affected part. Okay, so line of demarcation is not clear. I'm sorry, line of demarcation will not be clear. Extremely sorry. Line of demarcation will not be clear between the affected and the non-affected part. So, what are these? Microscopy, what is here? Cognitive necrosis, mucosa is ulcerated and slouched. Next, line of demarcation is not clear at all between the affected and the non-infected part, or you can say between the gangrenous and the non-gangrenous part. Okay, now let's come to the next topic, and that is pathological calcification. So guys, coming to the next topic, that is pathological calcification. Let's see what is pathological calcification. So the deposition of the calcium other than osteoid, okay, in tissues other than osteoid and enamel, that is called as pathological calcification. Repeating it once again, the deposition of deposition of calcium salts in tissues other than osteoid or enamel. Okay, it's called as pathological calcification. Now, coming to the types. So, there are two types of pathological calcification, and the first one is dystrophic, and the second one is metastatic. Okay, the first one is dystrophic calcification, and other one is metastatic calcification. Fine. So these are the two types of pathological calcifications. Now let's come towards the histology. Okay, so histologically, in usual H&E stains or H&E sections, how you will see the presence of calcium salt, they will be they will be visible as deep, irregular, basophilic, and granular clamps. In normal H&E staining, the calcium salts will be visible will appear as deep, irregular, basophilic, and granular clamps. Fine. Now, for the conformation of salt, of calcium salts, there is a method we called it as silver impregnation method of von Cosa. What is this for? For the salt, calcium salt conformation. And what is that? Silver impregnation method. That is von Cosa. All right. Now, let's come to dystrophic calcification and metastatic calcification. Okay, guys. Now let's come to the dystrophic calcification. First of all, we will see where does dystrophic calcification occurs. It occurs in two places, either in calcified dead tissues or either in calcified degenerative tissues. Okay, from the words itself, dystrophic, in tissues that are either degenerated or that are dead. Okay, so the examples where calcification in dead tissues. For example, you will find dystrophic calcification. You can find first of all in what are the examples in the calcification of dead tissue? Where will it occur or where will it appear? That is, you will find it in gaseous necrosis, fat necrosis, thrombi, infarcts, liquefactive necrosis. Okay, so mostly all the necrosis as well as thrombi and infarcts, you will find the dystrophic calcification, especially the calcification that occurs in dead tissue. Fine. Repeating it again, where will it appear in gaseous necrosis, fat necrosis, thrombi, infarcts, and liquefactive necrosis. Whereas calcification in degenerative tissues, obviously in degenerative tissue, the tissues which are dead. Okay, what are those? Either in dense old scar, in atheromas, in shamama bodies, okay, in stroma of tumor. So these are the examples in cysts. These are the examples where calcification in degenerative tissues will be also found. Now let's go towards metastatic calcification. So guys, coming to the metastatic calcification, first of all we will see where and what are the causes that it occur. Metastatic calcification occurs in normal tissues due to hypercalcemia. Okay, it occurs in normal tissues due to hypercalcemia. Next, what are the causes? First one is excessive mobilization of calcium from the bone, and the second one is excessive mobilization of calcium from the gut. Okay, so what are the causes? It is excessive mobilization of calcium from bone and excessive absorption. I'm really sorry. Excessive mobilization of calcium from the bone, and the second point is excessive absorption of calcium from the gut. One side there is being the mobilization of calcium from gut, another is being the absorption of calcium from the gut. All right. Next, in what are the cases we can find where does the excessive mobilization of calcium occurs? Well, you can see it in many metastatic bone lesions. You can see it in hyperparathyroidism, bone destructive lesions, and hypercalcemia itself. And excessive absorption of calcium from the gut, it occurred definitely hypervitaminosis, that is vitamin D, for example, and renal tubular acidosis. So this is all your metastatic calcification or pathological calcification explained. Okay, that's it. And guys, please subscribe to my YouTube channel, Revise Pathology. Even you can follow us on our Telegram. The link will be given in the description. And you can even follow us on our Instagram page. Okay, that is Revise underscore Pathology. Its link will be also given in the description. Fine. And stay tuned to my channel, Revise Pathology. Like, comment, and share my videos. And take care of your health. Allah Hafiz.